Today, I want to talk to you about arthritis, a degenerative joint disease that affects millions of people worldwide. Arthritis is a painful condition that can range from mild to excruciating, and more than 200 diseases are classified under this name. However, most arthritic conditions fall into two categories, which are osteoarthritis and rheumatoid arthritis. So, first, let's talk about osteoarthritis, which is the more common type of arthritis, affecting over 50 million Americans and 80% of people over 50. Osteoarthritis occurs when the cartilage that protects the bones from rubbing against each other wears down, causing pain and inflammation. This type of arthritis usually appears in joints that do most of the body's hard work, such as knees, hips, spine, and hands. Although injury or the normal wear and tear of life often brings on cartilage damage, it can be made much worse by food allergies, poor diet, and mineral deposits in the joints. Additionally, the effects of mental and emotional stress can also aggravate arthritis pain. Changes in the weather, usually rain and falling barometric pressure, often cause arthritis flare ups. Secondly, rheumatoid arthritis, RA, is a different type of arthritis caused by an inappropriate immune reaction in which white blood cells attack the cartilage in the joints. RA, rheumatoid arthritis, can destroy the bones themselves and even the muscles and skin, leading to severe pain and disability. While osteoarthritis affects men and women equally, rheumatoid arthritis appears 3 times more frequently in women. It affects only 2 to 3% of the population and can occur at any age, even in childhood. The course of the disease is difficult to predict, as it may disappear a few months after its appearance, or it may grow progressively worse. Experts disagree over the causes of RA, but it seems clear that genes, food allergies, bacterial or viral infection, stress, excess acid in the body, and the presence of certain antibodies in the blood all play a role. It's essential to note that many complementary therapies used for osteoarthritis are also effective in reducing the pain and slowing the spread of rheumatoid arthritis. Additionally, underlying factors for both of these conditions may include poor digestive function, intestinal permeability, hormonal imbalance, nutritional deficiencies, food allergies, and lifestyle factors. So, symptoms of arthritis can include morning, and these are symptoms of osteoarthritis. They can come on gradually and progress as follows, and they include morning stiffness, painful, swollen joints, restricted range of motion, deformity of joints in some cases. And the symptoms of rheumatoid arthritis include inflammation, pain, tenderness, discoloration in the joints, usually the shoulders, elbows, wrists, fingers, ankles, or toes, morning stiffness, lumps under the skin at the site of damaged joints, deformity of joints in long-term rheumatoid arthritis, fatigue, weight loss, weakness, and occasionally fever, and chronic infections. There was a study conducted by Canadian researchers who investigated the correlation between synthetic hormone replacement therapy and the incidence of arthritis in women. And the results revealed that those who used synthetic hormones for more than 5 years were twice as likely to develop osteoarthritis compared to those who did not use such therapy. Similarly, another study on the link between synthetic estrogen replacement therapy and arthritis showed a 96% higher risk among women who used ERT for 4 to 10 years. So, root causes of osteoarthritis, besides the synthetic hormone replacement therapy as discussed earlier, would be fractures or other injuries, even those that happen early in life, food allergies, a diet high in bad fats, such as an overabundance of omega-6 seed oils, common in fast foods and junk foods such as canola oil, vegetable oil, and corn oil. Excess of body fat, which places extra stress on the joints. Emotional stress, poor digestion health, increased intestinal permeability, bacteria imbalance, hormone imbalance, and biochemical imbalance. For example, poor posture or abnormal foot arch. Root causes of rheumatoid arthritis. No one's exactly sure what causes rheumatoid arthritis. It is likely multifactorial, but some probable causes include autoimmune malfunction, infection, like mycoplasma, viral, fungal Lyme disease, and others, overgrowth of harmful bacteria in the digestive tract, food allergies, toxic metal accumulation, emotional stress, and genetics. There are several testing techniques also that can give you an assessment of possible metabolic reasons for arthritis, such as the hormone analysis by saliva, urine, or blood for estrogens, progesterone, DHEA, cortisol, IGF-1, and thyroid panel. Also, fasting insulin levels, which is blood. Food allergy or sensitivity testing, including screening for celiac disease or gluten intolerance. Intestinal permeability, urine test. Stool analysis for bacteria balance, parasites, fungal, and food breakdown. Vitamin and mineral analysis, blood or urine. A toxic metal test, hair analysis, or urine blood work for infections. So these are several testing techniques. And now I'd like to share with you two very powerful formulas that I would personally take for arthritis, either rheumatoid or osteo. This is based on Master Herbalist John R. Christopher's teachings and his herbal calcium tea formula. And Master Herbalist John R. Christopher was one of my main teachers in the field of herbalism. He was a renowned herbalist who developed a formula called herbal calcium tea, which is believed to have helped many with arthritis. So the formula contains 6 parts horsetail grass, 4 parts oat straw, and 3 parts comfrey root. And I will include in the notes and slides a link to where you can buy it. And I also have a video that walks through, in the video, I'm walking through exactly how I buy the herbal calcium tea formula. So I think I'll link to that instead. It gives a much fuller explanation. You can follow the same steps from that video for the other formula as well. Okay, so anyways, the calcium tea is made of horsetail grass, oat straw, comfrey leaves, and lobelia. I don't put the lobelia in my formula, but that was in John R. Christopher's original formula. Now, horsetail grass and oat straw are high in silica, and calcium can't be used in the body without the presence of silica. The other herbs support the function of the silica herbs in helping the body assimilate calcium. These are the teachings now that I'm going through. These are the teachings of John R. Christopher. Now, so as I mentioned, he also adds 1 part lobelia to his formula, but I personally omit it, and instead I add either juniper berries, hawthorn berries, peppermint, goji berries, ginkgo, biloba, etc. I like to rotate between different healing herbs each time I take a batch so that I'm not drinking the same tea all the time, which is a recommended practice in holistic healing, to modify one's regimen from time to time so that your body doesn't become desensitized. So I started drinking this herbal calcium tea formula by taking a heaping tablespoon. I started by taking 1 heaping tablespoon of the herbs mixed together in tea, and I worked my way up. I found great relief with 1 tablespoon, but then sometimes, I felt like I would be in more pain, or I got pregnant, or different issues would come up, and I felt like I needed to increase my dosage. Well, currently in my present situation and age, I drink about 1/4 cup of herbs every other day. So it's about an eighth cup of herbs every day, or a quarter cup of herbs every other day. And I have found this to be my current ideal dose that helps me with all sorts of problems, such as sciatica, bleeding gums, toothaches, cavities, Charlie horses, painful joints, etc., all of which were healed using this one herbal calcium tea formula. And I recommended this formula to all my family and friends as well. I drink this tea along with my 9 children every other day. Sometimes when we are experiencing pain, such as toothaches or back pains or injuries, we drink more. And I recommended it to people who reported that it has helped them with arthritis, back pain, dental cavities, heart palpitations, and more. Many people have reported success in using this tea to alleviate arthritis symptoms. For example, there was one woman who shared her experience on a health forum, stating that she had been suffering from severe arthritis pain for many years, but after drinking the herbal calcium tea for a few weeks, she noticed a significant reduction in her pain and inflammation. Another individual wrote a testimonial on an herbal remedy website saying that they had been diagnosed with rheumatoid arthritis and had been taking prescription medications for years without any improvement. And after trying the herbal calcium tea formula, they noticed a remarkable improvement in their mobility and overall well-being. So the herbs in this formula are almost always prescribed for muscle cramps and throughout pregnancy generally. I pretty much double my dose whenever I'm pregnant or breastfeeding the first few years. Yet, calcium requires the proper balance of phosphorus, silica, and magnesium to be absorbed. Otherwise, the free radical calcium flows through the bloodstream, sometimes depositing in the forms of cysts and calcium deposits. These are the teachings of John R. Christopher. Often, people who suffer from arthritis and related problems, arteriosclerosis and calcium deposits, are taking plenty of calcium supplements, but their bodies cannot assimilate the calcium in this form. So the best calcium supplements you can take, other than calcium-rich foods, is Dr. Christopher's Herbal Calcium Formula, which contains exactly the right proportion of silica because of the horsetail grass. Now, I used to take calcium supplements, but I found that drinking the herbal calcium tea was far more superior than to taking the regular calcium supplements. I used to take calcium supplements for Charlie horses and painful joints, and it did help with that. But I decided to try the herbal calcium tea formula instead because it was a natural source, a natural way to increase calcium in my body. And I found that it was so much more powerful. And I experimented by stopping the calcium supplement, and it was perfectly fine. All I needed was the tea, and I also eat calcium-rich foods such as dairy, goat milk, fermented dairy products, which are really healthy, and other things, other types of foods that naturally contain calcium. So that plus the herbal calcium tea has been so powerful and effective that I don't have to take calcium supplements anymore. So Master Herbalist John R. Christopher teaches that we need calcium for nerve sheath, vein, and artery walls, bone, and teeth. This combination in this herbal calcium tea formula is all pure herbs, and it's also used for cramps, Charlie horses, and for all types of calcium needs in the body. Now, sugars, pastries, soft drinks and alcoholic beverages, breads, candies, etc., leach the calcium out of the body, which causes varicose veins, cramps, Charlie horses, loss of teeth, nervous upsets, etc. And also remember that poor diet like this and poor gut health can all play a factor in arthritis, both types of arthritis. And allergy to milk is quite common. Symptoms include asthma and nasal congestion, skin rash, and various chest infections, plus other less noticed symptoms such as irritability and fatigue. Milk causes allergies by diminishing hydrochloric acid necessary to digesting protein, causing the undigested protein to enter the bloodstream and promote allergic reactions. The calcium in regular pasteurized homogenized milk does not metabolize properly either. Raw milk is much healthier, so we drink either raw milk or goat milk, but raw milk is much healthier because it has enzymes needed to digest it, and goat milk is closer to human milk and therefore better for digestion. Also, osteoporosis John or Christopher advises women to start calcium and vitamin D supplements at age 30 or perhaps 25. So vitamin D or getting sunshine is also really important for calcium and bone health. Okay, so you might want to also look into supplementing with vitamin D, but we'll talk about vitamin and mineral and other supplements later in a different lesson. Right now, I just want to focus on the herbs mostly. But sunshine is important. This is part of what Master Herbalist John R. Christopher teaches. Okay. Also, he talks about cortisone users and how many people are taking cortisone, all those several million of them, and they're not aware that this drug can cause brittle bones. And how many doctors are going to tell their patients that it is a good idea to get substantially more calcium and vitamin D into their diets before they begin splintering their bones because of cortisone. So I don't know if that may be something that these are all things that you might want to look at. Okay. Now I don't have personal experience taking this herbal formula, but it is again another important formula that Master Herbalist John R. Christopher recommends for arthritis. Okay, so this is called the Complete Tissue and Bone Formula. It was previously called the BFNC or Bone, Flesh, and Cartilage Formula. It's been renamed to Christopher's Complete Tissue and Bone. Now, a note about both of these formulas is that you have to, if you're going to take these herbal formulas, you have to take them by buying each herb in bulk and mixing them together. And the reason is because it's not sold in its original form anywhere together mixed already. Even in Dr. Christopher's herb shop, they do not sell the original formula. And I believe I have found from my personal experience that for example, the herbal calcium tea is not as effective without the original formula, particularly the comfrey root. Okay, and the reason why they don't put sometimes they alter the formulas is because of pressure from the FDA, but really the FDA's warnings against these herbs are unfounded. Let's just say that. Now I do have in my herbal calcium video and lesson and notes. This is a different lesson, different notes. I do have information about that whole controversy. So if you want to look that up, you can. You can go to arukah.com/calcium, I believe, and look that up. Okay. Okay. Now, so this particular formula, Dr. Christopher's Complete Tissue and Bone Formula, consists of 6 parts white oak bark, 3 parts marshmallow root, 3 parts mullein herb, 2 parts wormwood, 1 part lobelia, 1 part skullcap, 6 parts comfrey root, 3 parts black walnut, bark and leaves, and 3 parts gravel root. Now, remember to keep in mind that when I say part, this is a measurement of volume. So a part could mean cups. If you want to use cups, it would mean 6 cups of this, 6 cups of that, 3 parts of this, 2 parts of that. And we're talking about the cut and sifted herbs, loose leaf herbs, not the powdered version. Okay, we're talking about the herbs that they would come in the form that they would come in if you harvested them yourself, broke it up into pieces, and put it into a tea or in bags of tea. Okay, we're not talking about the powdered version. Okay, so this formula is using the same treatments as the BFNC, the previously known BFNC bulk formula, and it's an aid for malfunction in bone, flesh, and cartilage. It's been used to treat broken bones, sprained ankles, torn ligaments, scrapes, cuts, and wounds, and it's also excellent for varicose veins, curvature of the spine, skin eruptions, pulled muscles, blood clots, and calcium spurs. Primary use is internal, though it may also be used externally. So notice that in both of these formulas, comfrey root is one of the main ingredients. So this combination does wonders in restoring flesh and internal healing of bones and cartilage. It can be taken in any of its forms. I recommend the tea. I think this is the most powerful way to take it is internally as a tea. It's also used as a salve And this formula has done awesome things for broken backs, legs, hips, etc. It's been also used for curvature of the spine, polio, multiple sclerosis, muscular dystrophy, stroke, and arthritis, of course, of the bone. And it's used externally as well as orally, and it's brought many people tremendous and fast results. This formula is a powerhouse that has been used on and restored to health people who have cancer of the spine, arthritis, and polio. And it's helped rebuild torn cartilage, sinews, fractures, etc., etc. Bone spurs from arthritis. Someone gave Master Herbalist John or Christopher a testimony saying, "I've tried your comfrey herb combination for dissolving calcified bone spurs caused by arthritis when a teenager. And my metatarsal arch in left foot was in such bad shape it had become very painful to walk. The herb began bringing results immediately." Okay, so that's a testimony about this formula. So I would highly recommend both of these formulas. Another thing that Master Herbalist John or Christopher recommends is cayenne, using cayenne cream, or what we do is we'll mix cayenne powder in some coconut oil and then apply it topically to the affected area 2 to 4 times daily for symptomatic relief. Now, this is topical, but it really doesn't address the root cause. The complete tissue and bone formula and the herbal calcium tea formula, they help address the root cause. Okay, so that's all for this particular lesson. In the next lesson, we're going to talk about nutrition and diet for supporting arthritis. And you can also download the notes for this lesson, and also so get the notes for this and links and stuff like that for this lesson at arukah.com, arukah.com/arthritis. Okay? This is Mayim Vega, your naturopathic herbalist and holistic life coach. And if you are interested in personal health coaching or becoming a holistic healer, a certified holistic healer, please visit our website at arukahmethod.com. That's ARUKAHMETHOD.com. Shalom.